Healthcare workers continue to line up for the J&J booster jabs. The Sisonke second trial started last week. It's in anticipation of a fourth wave expected next month or maybe in January. Health Department Acting Director General Dr. Nicholas Crisp joins me now on Zoom for an update. Doctor, very good evening. Thank you so much for joining us. Let's start with that, the booster doses started a few days ago. How are you going with, how's that going?
Yeah, good evening, and good evening to the listeners. So we've done, in the last 4 days since it started, we've done just over 45,000 vaccinations, which is about 10% of the total number of people in the Sisonke 1 trial.
There was a little bit of hesitation at the beginning. Some of the healthcare workers saying there was misinformation, they didn't know, where to go and so forth. Was that all ironed out?
Yeah, I know that we were due to get started on the Monday, and then it was delayed to Tuesday, and then there was a whole lot of load shedding that happened, and there were problems with the logistics because of load shedding. So then it only started on Wednesday. But my information is it's going well. I watched the WhatsApp groups of the discussion amongst the staff and other WhatsApp groups amongst people who are beneficiaries, and it seems like it's going pretty smoothly. There's some very nice compliments, in fact.
All right, that's great. Let's talk about the vaccine program now. Where are we standing at the moment? We were just reading that we're slightly over 23 million. But can you break that down for us? Obviously, because some is just the first jab and some would now be fully vaccinated. Where do we stand?
Yeah, so I think, sometimes people get fixated on numbers, but we are well over 24.2 million as of this afternoon. Of total vaccines administered, and that might be slightly higher than that because we know that there are some paper records around. But for all intents and purposes, we crossed the 24 million mark. And then we count how many are individuals vaccinated. So that's about 15-something million at the moment. And then there's a number of how many are completely vaccinated. And those are moving targets because in the beginning, it was one J&J vaccine was regarded as a completed primary dose, and two Pfizer's were regarded as a completed primary dose. But around the world, those targets are beginning to change, and in some places, there's already talk about making Johnson & Johnson a 2-dose primary and all kinds of other things that are being debated in the scientific space. So I think rather than get fixated, what we must really push for is to say we want the largest possible number of people to be vaccinated, and we are already vaccinating adolescents. But mostly, we want to vaccinate vulnerable people. And the most vulnerable people are those over the age of 60 and those over the age of 50, and then a small group of people who are immunocompromised because they've had organ transplants, or they're on dialysis, or they've got cancer, and there are one or two other conditions as well. So that is really where we are focusing our greatest attention. And we are already getting over 65% of 60-year-old pluses. And so we know that we should be able to get over 70% across the country for that age group. In fact, Limpopo province is over 75% already of people over the age of 60 are vaccinated. So there are sub-targets that we really do need to push for.
I suppose we are fixated by the numbers because we keep hearing about the fourth wave that we should expect, whether it's December or come January. We're hearing that it might happen after or immediately after the elections. There was a lot of electioneering campaigning. We saw many people ignoring, COVID regulations and so forth. 15 days now after the actual election itself, and we're still seeing low numbers. Is that shifting in terms of the fourth wave itself? Because we were very worried that, after the election, we're going to see numbers all of a sudden explode, but that's not happening.
Yeah, well, so I think, without trying to complicate or even, either not complicating or oversimplifying the matter, there are a couple of things that influence whether we are going to get a wave, how big that wave is, and when it's going to happen. So I think that experience has taught us from watching other countries and from seeing what's happened up to now that we will get a fourth wave. The things that we can do to limit the size of that fourth wave is to keep our distance, to wash our hands, to wear our masks, stay in ventilated places, and just generally not to behave badly in groups. That is a massive way of protecting all of us. The second thing we can do is get as many people vaccinated as possible, because we know the vaccines do prevent transmission and do protect us from getting sick and from ending up in hospital. So those are the two things we can do. The third thing that will influence our fourth wave is not really in our control. To some extent, it may be that we can limit transmission across our borders, but it's about whether we get another variant. So if we have the variants that our population has already been vaccinated against and exposed to, then the chances of a severe, large wave that is devastating and puts people in hospital is reduced dramatically. But if we get a variant that we haven't seen before and escapes our immunity, that's the technology, the terminology we would use, if we get some kind of variant that we as South Africans who have been exposed and vaccinated and sick in the past and have immunity to, then we could get quite a serious wave. But whether those waves will be as big as the first three depends on the other factors. So there's never only one factor. So our appeal to the public is, now is not the time to let your guard down. Now is the time, please, in the public, to keep wearing your masks, keep washing your hands, keep your distance, don't get mixed up in crowds, stay in places that are ventilated as far as you possibly can, and get vaccinated. And if you do those things, and if more of us do those things, we will definitely limit our exposure to and the size of the fourth wave that's going to come.
So, Doctor, the vaccine certificate, there was a lot of hoorah around it when, with the SMSs and so forth, which is brilliant. But, what are we going to do with it? Because it's been a while now, and we're waiting to see whether, let's talk about sport, for instance, whether we can go back into stadiums and so forth. Are we going to be able to use that certificate? What next?
So there's the health department's responsibility, and then there's the responsibility of everybody in society. So the health department has taken the responsibility to make the vaccine certificates available. We needed to do that ourselves because it takes the data off our vaccination database to provide a verifiable certificate. Now we are working from the health authorities together with other government departments, notably sports, arts and culture, and they have played a lead role in making rules around stadiums, sporting events, arts and cultural events and so forth. But there are other parts of society as well, including restaurants, where we've seen people, some restaurants, in fact, I saw a delightful one sent from a restaurant the other day to me that said, if you are registered, you get a 10% discount. If you are vaccinated with one dose, you get a 25% discount. And if you've got full vaccination, we'll give you a 50% discount to come into our restaurant. So what they are doing in society, people are taking the initiative to say that we want vaccinated people to have more freedom and allow them into, the kinds of things we want to do to, as the sports minister said, freedom to play. So that's what's being planned at the moment. And we've been discussing with as I said, a number of other government departments about just how fast and how big we can allow those crowds to become. And that would include for religious gatherings and so forth. So what would be irresponsible is just to say, no more masks, no more lockdown, no more nothing, you're welcome, do your thing. That would be asking for trouble. But I think that we certainly do feel that there's lots of room to open up and allow people to do the things that give us a chance to socialize and be the human beings that we really want to be.
Dr. Nicholas Crisp, thank you so much for speaking with us and clarifying a few issues. Acting Director General at the Health Department. So the booster doses are going well. They're being administered to all the healthcare workers as part of the Sisonke project.